Hello, I'm Ryan Ferdyhert with the Center for Practical Bioethics, and this is the Clinical Ethics Corner. Time can be a challenging thing. We can only live in the present, but we understand that present by the past and the future. Decisions cannot exist in a time vacuum where we are entirely focused on the decision itself and not the future complications that decision will create. When we are making decisions with patients and discussing the realities of those decisions, we have to take into account the future those decisions create. Take, for example, we recently had a patient in the ICU. The patient was a middle aged woman suffering from respiratory duress. She had multiple medical complications and had to be intubated and put on a breathing machine. That was about 2 weeks ago, and the patient had not improved. Now, the medical team is discussing the placement of a trach and a peg and would likely then have to send the patient to a skilled nursing facility for the patient to make a full recovery. This situation is complicated due to the patient's immigration status. The patient is undocumented, and the rest of the patient's family lives out of the country. This is challenging the decision to place the trach because the medical team is asking, then what? Because of the patient's undocumented status, finding placement for this patient is next to impossible. The patient does not have health insurance, but unlike similar patients who are citizens to this country, this patient does not have a path to insurance. While other patients could possibly go on Medicaid, this patient will likely never qualify and thus will never establish health insurance. The hospital is also a relatively small hospital with only 4 ICU beds that are constantly full. Should this patient receive the life-prolonging interventions for only to stay in the hospital, occupying an ICU bed with little to no expectation of the patient ever leaving? When we discuss concepts such as justice, we have to take into account the full situation of what justice means. Justice does not necessarily entail every patient receiving everything possible, but rather that patients are treated fairly. How should a lack of path to insurance, and thus the patient's immigration status, impact the other principles, such as what is best for this patient and what is the patient wanting? Unfortunately, one of the aspects of medical ethics, and all applied ethics, is that we are often tied down not by what is right, but what is best. What can we actually achieve for our patients rather than the ideal? That can cause troubling situations where healthcare teams know what is right for the patient, but are unable to deliver it fully because of the additional restrictions. And with the current political climate with limits and restrictions put upon those who qualify for resources, those situations and the moral distress that comes with them will only happen more often. These are going to become more and more common and will not change the challenging nature of them as they get even more and more complicated. This is something that needs to be understood and addressed so that we can better provide for our patients. Thank you. My name is Ryan Ferdyhert with the Center for Practical Bioethics, and this has been the Clinical Ethics Corner.